This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is Preventing Diabetes and Prediabetes. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen, and we will answer as many questions as we can once the presentation concludes, and your questions will remain anonymous as always. I'd like to introduce you to today's presenter, Elizabeth Giordano. Elizabeth Giordano has been a registered nurse for more than 20 years. After graduating Binghamton University with her BSN, she began her nursing career at NYU working on their surgical unit. Elizabeth then became a nurse at St. Francis Hospital, where she began as a staff nurse and grew to an assistant nurse manager for 6 years. In 2008, Elizabeth started her career at Mather Hospital in critical care nursing. After working in the ICU for 8 years, she obtained her critical care national certification, and soon after, she accepted the position of diabetes educator in March 2016. Elizabeth also obtained her master's degree at NYU in holistic nursing and has used this degree to help her treat patients with diabetes as a whole person instead of just the disease. Elizabeth is happy to offer her patients valuable education, which helps them improve their quality of life. Elizabeth, go ahead and get us started. Thanks so much for joining us today.
Thank you so much, Emily. That's a great introduction, and I appreciate all your help. I'd like to say thank you to the community for letting me speak today about a topic that is so important. Trying to prevent prediabetes and diabetes is something that is so valuable because a lot of people aren't aware that they can make a difference in their lifestyle, in lowering their blood sugars, in doing some activity that helps to reverse insulin resistance. And I'm going to go through some of these things today and talk about how you can make a big impact in your own life. So I always say you are your own best advocate, and the information that I'm going to give you today will help you to make healthy choices and help you to be proactive about your own health care. Some of the objectives from today are to understand what risk factors you have for diabetes, to understand what the A1C level is and what that means in terms of risk for diabetes, to be able to list 2 lifestyle changes that will help to decrease your risk for diabetes, and also, since this is always a hot topic, to be able to read a nutritional label and understand the carbohydrate content of different foods. I always say that as a diabetes educator, a lot of people think that most of what I do is teaching about diet. However, we do hit on a lot of different topics within diabetes care and diabetes self-care, such as taking your medications. You know, how does a person do with taking their medications every day? Or are they able to exercise? Simple things like, are they going to the doctor when they need to be going to the doctor? I also talk to patients about communicating with their physician, which is really an essential part of diabetes care. We need to be able to help patients to know the right things and when to communicate with their physicians. So we're going to talk about some of these things today. I also hope that if you do have questions, like Emily said, maybe jot them down, because we are going to do a little question answer session at the end of the presentation today. So it's more organized and easy to do all the questions at one time. Okay, so I really appreciate your help with that. And I also wanted to say that just like the disclaimer before, there is no this presentation is not a substitute for real care from your physician. That is a valuable experience. What I'm going to talk about today is more lifestyle, understanding your own risk for diabetes, But by no means is this medical advice. I am a nurse and I'm speaking from experience in my nursing career and as a certified diabetes educator. Okay. All right, so our first slide, we're going to look at some risk factors for diabetes. Sometimes people are surprised, who is at risk for diabetes? Well, I have to say, most of us are. A lot of people think, oh, well, I'm very healthy, I'm not at risk. Well, look at the first risk factor. How old are you? We all have to have birthdays, right? Can't skip those. So the older you are, the higher your risk is for diabetes. Second question is, are you a man or a woman? Men will get a point, whereas women have 0 points. So being a man increases your risk. As a female had gestational diabetes, that's how I got interested in diabetes. Gestational diabetes means that you have diabetes for a short time during your pregnancy. When the baby is born, the diabetes goes away. So it's like a little taste of what diabetes life is like. Family history. This is very big. And again, like I had said before, whether or not you live a healthy lifestyle is very helpful, but sometimes we can't always fight the genes. So genetics plays a very big role. I'm sorry about the phone. That will have to quiet down. We cannot control our family history, but we have to make sure we take it into account. All right. So when we talk about family history, it doesn't mean your great grandpa or your aunt. It specifically has to do with your parents or your siblings. And if they have had diabetes, that will increase your own risk. Do you have high blood pressure? Literature and the research shows that if you have high blood pressure, that does increase your risk. Are you physically active? I kind of laugh when we talk about this because at the beginning of my career as a certified diabetes educator, I asked, well, what constitutes active? I'm not sure how to gauge. I think most people think they are active. And the answer that was given to me was, well, if the person works, they're active. And I have a little trouble with that because a lot of people who work sit at a desk. So I think that question, sometimes I'll ask, do you walk during the day? Are you up and about in your house? If you do have a desk job, do you take breaks? Do you go out for a walk? That question is a little bit subjective. Last question, what is your weight category? So in the diabetes education world, we do not talk about weight a whole lot. We like to focus on healthy activities like healthy eating and, getting back to some exercise. But on the risk factor test, the heavier someone is, the higher their risk is for diabetes. So we can't ignore the research. If the more someone weighs, and you could see this the way it's graded, the more points you would have higher risk. So the way they do the risk test is they say, if you do score a 5 or a higher, speak to your own physician about your diabetes risk, okay? Which starts a conversation with your physician. And there are other things that can elevate your blood sugar. So we are going to talk about those things today. But this risk test is like a good starting point. Where am I? I call it the diabetes spectrum. I am at risk always because of my history of gestational diabetes. So when I go to the doctor, I always ask them, hey, how is my A1C level? And we're going to talk about what that means. But there are ways of keeping tabs on your own risk. And that's what we're going to elaborate on in a little bit. Okay, so here are some of the risk factors that are modifiable: your activity level and your weight, right? We can't change how old we are, can't change our family history. There has been some talk that, oh, you can control your blood pressure. Yes, but that doesn't really change the history that you have high blood pressure. So again, I don't really find that one to be modifiable. So as a diabetes educator, I will talk about your activity level with you, or how can we modify your weight based on maybe your food, right? I don't like to use the word diet. Diet is perceived as a negative word. But how can we maybe make your food a little healthier, and thereby, by speaking about the activity and the healthy food, we can modify your weight, okay? This is a very important factor when I talk to patients about their diabetes risk. If someone smokes, their risk for diabetes will go up 30 to 40% as opposed to someone who does not smoke. I'm not really sure professionally why this isn't on the risk test yet, but I think it's a very important topic that I bring up with patients all the time when they're in prediabetes, when we catch them in prediabetes. So if anybody listening today smokes, that would be a modifiable risk factor that you could change, right? I know it's a difficult habit to break. I'm not downplaying how hard it is. I'm just saying that if you have the ability to quit, this is a good motivator, right? If it's going to increase your risk for type 2 diabetes, I think that's an excellent motivator to quit smoking. All right. Why does smoking increase diabetes risk? A lot of patients ask me this. I think sometimes because it is so difficult to quit, patients question, is that real? Like, is that a real statistic? And yes, unfortunately, it is real. If you look it up, I got my information from the CDC website. And I do a lot of work here at Mather on the mental health unit. And I initially found that fact when I was doing research for a presentation on the mental health unit. So it is real. And the reasons here are that insulin actually helps, your blood sugar to enter into a cell, but the nicotine in the cigarettes changes cells so that they don't respond to the insulin the way that they should. In turn, what winds up happening is your blood sugar levels go up, okay? Because now the insulin that is supposed to act like a key and open up your cell, and all the blood sugar will go into your cell. Now the insulin goes over to the cell and it doesn't work. It doesn't open up the cell, all right? I think everyone is probably aware through all the advertising that goes on for promotion of quitting smoking. There's a lot of chemicals in the cigarettes themselves, and these chemicals also contribute to inflammation in our bodies. So that inflammation also makes the cells stop responding to the insulin. Another interesting fact, and I wasn't aware of this, people who smoke have a higher risk of abdominal fat, and abdominal fat specifically will increase your risk for type 2 diabetes. Even if a person is not deemed overweight, if you have like a little belly, I don't know how to describe it, but a little overweight in the midsection particularly, that is a higher risk factor for having diabetes. Okay, this slide, I'm always a little bit hesitant to go over, but it is really important for everyone to understand. And I preface this by saying, I'm going to review some medications with you that will or have the potential to raise your blood sugar, but that does not mean stop taking your medicine. Please always take your medicine as ordered by your physician. That's really important for your quality of life and to achieve all your health goals. Steroids raise people's blood sugars. So when we have people sometimes that have like a diverticulitis, itis means inflammation. I have some people with chronic obstructive pulmonary disease. These type patients do require steroids sometimes, like prednisone. Steroids will directly affect your blood sugar by sending them up, and they become very elevated. Diuretics can raise your blood sugar, beta blockers, antipsychotics, antidepressants, statins, and sometimes chemotherapy, because chemotherapy does require that patients sometimes take steroids alongside their chemo agent. And of course, this is not an all-inclusive list. And I always try to explain to patients, when we look at these large groups of medications, what the literature says, it depends on the specific medicine, how long you're on that medication, and the dose of the medication. So all of those things will impact how that will affect your blood sugar. I do like patients to know about this because this can spur on a conversation with your own physician. I have a kidney disease. I am on a kidney medicine. And I recently said something to my physician because one of my glucose levels was a tiny bit elevated. And I said to him, I'm a little bit worried. Why is my glucose level up? And he said to me, oh, the medicine you're on can cause hyperglycemia. I said, what? I've read every piece of literature on this new medicine. So it's just interesting that even though I think I'm a good researcher and I read all the pamphlets on the medicine that I'm on, but I guess there sometimes is some off-label side effects that we're not aware of. So it is important, obviously, have that conversation with your doctor, get that conversation going, and it'll really help you to understand what's happening in your body. Again, like I said before, especially my patients with chronic obstructive pulmonary disease, it's obviously more important that they take that medicine, the prednisone, so they can breathe, right? And same thing with my patients that are on antidepressants. I say to them all the time, you have to take your antidepressant. It's imperative. So what we look at is how can we modify other things? How can we work on the other things? I don't want my patients to stop taking the medications that are really important for their quality of life. Okay. Race is also impactful in assessing someone's risk for diabetes. So if a person is African American, Latino, American Indian, Pacific Islander, or any group of Asian American, that can cause a elevated risk in diabetes. I had a patient once that was Samoan and lived a relatively healthy lifestyle, but was one of my new diabetes patients. And he was a Pacific Islander. So what I'm saying is that sometimes it's not within our control. That patient had told me diabetes ran rampant in his family, again, in the genes. So we have to work with what we can work with, all right? The genes are not modifiable, unfortunately. Why is knowing your risk so important? Like I had said before, I'm going to talk about the A1C, but if we catch someone in the hospital in pre-diabetes, I have the ability to talk to them about what they eat, how often they might take a walk. You know, do you take a walk a day? Do you do any activity each day or weekly? And thereby I can help them avoid diabetes. If we catch someone in pre-diabetes and they make some nice healthy changes, they can in fact delay the onset of type 2 diabetes. They can avoid diabetes and they can thereby change their glucose levels and go out of pre-diabetes. It's fascinating. So I always perceive people to be in pre-diabetes as a gift because it's a time when they can make really healthy changes and make a huge difference in their own life. So I get excited to see pre-diabetes patients. It's an exciting opportunity. So what we're going to talk about next is something called the A1C. And I don't know if you guys have heard about it. It is a blood test that you would have done when you have blood drawn. And I do hear that some of the endocrinologists who are diabetes doctors, sometimes they have a machine in their office that can check the A1C. But I have to tell you that the blood test is the most accurate when you get blood drawn. So what does the A1C do? The A1C is a value or a number that we can look at and we can tell how someone's blood sugars have been for the past 3 months. So unfortunately, when a person gets ill or sick, their blood sugar will automatically go up. And we do take this into account when we see patients in the hospital. Your recent illness has impacted your blood sugar levels, which will impact your A1C. When I look at someone's A1C, I will ask them questions like, have you been on steroids in the past 3 months? Tell me what's been going on in your life in the past 3 months. A lot of patients are not aware that stress raises your blood sugar. So when we think about what the human race has been going through in the past 2 years, the level of stress has been unbelievable. I have patients that have lost, 4 or 5 family members in the past 2 years. A lot of loss, a lot of illness. So it's been very, very stressful. A lot of people who are so sick that they can't do their job anymore. Stress will raise your blood sugar. Pain raises someone's blood sugar. So sometimes patients will have a medical condition that causes pain, and the pain sometimes, if it's untreated or not helped in any way, the pain is perceived as your body as stress, and that will in turn send your blood sugars up. So here again is a little picture of what the A1C is. And basically, you could see the red is a cell, blood cell, and the purple represents sugar that coats our cells. So when a person has a high blood sugar level, that's going to increase the coating of sugar on our blood cells. So the reason why this tells us the past 3 months worth of blood sugars is because these cells live for about 90 days. And I think that's really fascinating. And this number, the A1C level, really helps us to truly understand who in the hospital needs help with their diabetes. Let me see if we go through the numbers. Why do I have to discuss my A1C with my healthcare provider? Like I had said, different factors can affect your blood sugar levels. Were you sick in the past 3 months? Maybe you were immobile. So if someone's activity level is changed, where they have to, maybe they had a foot injury and they can't really walk around too much, that's going to affect their blood sugars. Pain, stress. So here is a slide that will basically tell us what the A1C levels mean. So if your A1C level is less than 5.7, I don't like this word normal because it means the other people are abnormal. That's not a good word. But less than 5.7 means you don't have any issues with your blood sugar, right? If your A1C is less than 5.7. If your A1C comes back between 5.7 and 6.4, that means you're in the prediabetes range, specifically 5.7 to 6.4. Those are the patients that I talk to about a healthy diet. Can they take a walk a day? Can they maybe do some chair yoga? If their feet are not healthy. We talk about all different things. Maybe they were on a medicine to help with their blood sugar and they haven't been taking that medicine. So it can mean a few different things, but I try to help that person to be a tiny bit healthier. So maybe they can, like I said, avoid type 2 diabetes altogether. And that is a possibility. The prediabetes population, a lot of people don't understand that sometimes all it takes is one change. And I guess I'm going to have to tell you what that change is. Sugary drinks. If you drink soda or even juice like regularly, that can severely impact your overall blood sugar levels. I had a patient recently that told me he put at least 3 spoonfuls in each cup of coffee he had, and he had between 8 and 10 cups a day. So you can imagine how much sugar that really is. That's a lot of burden on your system to try to metabolize all those sugars. It's very hard on your system. But a lot of people don't think of the whole day. Juice, which a lot of the population thinks is a healthy drink, is a lot of sugar on your system. So sometimes I'll talk to patients, they can make one change and it'll so severely impact their overall blood sugar that they'll get right out of prediabetes. And that's a wonderful thing. It's really exciting. If your blood sugar is great, if your A1C, if your A1C is greater than 6.5, that means you're in the diabetes range. It kind of breaks my heart sometimes when I see patients in the hospital and they say to me, Beth, it is not possible that I have diabetes. I just went to the doctor. And my only answer is not every doctor orders this A1C level. So you could potentially, I'm sure all of you are aware, when you get blood work done, sometimes they have you fast. It is possible that your morning blood sugar comes up normal, but that doesn't mean your A1C is in the normal range. there can be a discrepancy there. So unless the physician or the practitioner is specifically ordering the A1C, we don't know how your blood sugars have been for the past 3 months. All right, well, and we'll talk about that a little bit more. So here is the breakdown of what the A1C level actually means in terms of your blood sugar level. So it's very hard for people to understand, even when I showed you the little picture of the sugar coating the cells. Well, what does it mean? So I use this to explain to people or my patients, if your A1C level is 8, that means your average blood sugar for the past 3 months has been about 183. And I'm sure we're all aware of how the law of averages works. You have some above, some below, but it works out to be an average of 183. I see patients in the hospital, A1C 14, A1C 15. We see pretty high A1Cs here. And some of those patients have to be on insulin. Sometimes there is no other way to pull out those blood sugars down. They need to go on insulin for a short time. Some people find out they have diabetes in the hospital, and like I said before, they had no idea. So that's why we fully encourage you to do that risk factor test. Have a conversation with your doctor. The doctor may have never asked you before, do you have diabetes in your family? That's a key question. If you say yes, that doctor should be ordering an A1C for you to see where you are. How are you doing? It's very important, okay, to know your own risk and to talk with your physician. That's a valuable conversation. So like I said before, why is knowing someone is in prediabetes so important? Because I think it's a time where people can make changes. You can really make changes and make a difference. You can delay or avoid the onset of diabetes if you're able to modify your lifestyle. And that's up to the person. I've had patients say to me, I am Italian and I love to eat and I'm not changing anything. And that's up to the person. I'm not a magician. I love to help people see the big picture, but the patients are the boss and you are in control of your life. And if people don't want to make changes to their lifestyle, I say to them, well, you still have to keep in tight communication with your physician and plan ahead and see what that means in lieu of medication and what medications they'll need. But most people are pretty flexible and say, hey, yeah, I can give up that liter of soda I drink a day. That's not an issue. Or I can give up the Arizona iced tea. It's not a big deal. And then sometimes I'll get calls and they'll be like, Beth, that made such a big difference. I'm so happy. They'll call me and tell me that their A1C is better. And those are the messages that I love. I love it. So if you do feel or that you're in that prediabetes range, the one important thing is to make sure you get it rechecked, right? So the A1C can only be checked every 3 months. If you try to do it sooner, you're not going to get the result that you want. You have to let some of those elevated cells die off, right? So to wait the full 3 months, you'll get a better number if you made those changes. But it is important to ask, hey, and I'm going to try to make some changes at home. Can you order an A1C for me in 3 months? And most doctors will do that. To see if your interventions or your modifications worked, right? If they didn't work, we have to try something else. And that's important to know. What I have learned from the literature is that the sooner you know you're in diabetes, the easier it is to change that number. So if I have someone who hasn't been to the doctor in 5 years, and then they learn they're in prediabetes, sometimes it's much harder to get them out of the prediabetes than it would be if I have a person that just learned, a week ago, I went into prediabetes or a month ago, because I think they say the window is about 18 months where it's easier to turn around. Okay, so I hope that helps some people. Okay, there's a wonderful program called the Diabetes Prevention Program. And I know that this is a CDC run program that is held throughout the United States. So if you guys wanted to join a program like this, you would literally just look on the internet for the Diabetes Prevention Program. And what they usually do is they'll ask you to put in something like your zip code, and then they'll tell you where there is a program near you. But the DPP, or the Diabetes Prevention Program, was started to help people turn it around, just like I was saying before. So if your doctor says to you, I'm sorry to tell you, you have prediabetes, you could essentially qualify to be in this program, and sometimes your insurance will cover it. So it's really nice. So this program is essentially put out by the CDC, includes handouts, resources, a lifestyle coach, and you essentially have your own support group because the people in the group are going through the same thing that you are going through. And together you share ideas, you share what works. I always think of like Weight Watchers, how Weight Watchers encourages people to hold each other accountable. So in the diabetes prevention program, what they have is the first 6 months, you go every week. So it's pretty, intense. Every week you go for the first 6 months. They have meetings. And then in the second 6-month time frame, you go every month. But there's still a lot of sharing going on. Interestingly enough, I think when I first learned about this program, they were trying, someone reached out to me and said, Beth, do you think you could be a DPP, educator? But the problem is that I am the inpatient diabetes educator from Mather Hospital. The DPP is a commitment, and it requires a lot of time and energy. So there's no way I could do that. That would be like having 2 jobs essentially. But I love it because it doesn't teach you, tricks. It's more like, let's move towards a healthier lifestyle. Let's just do it. And you do it all together as a group. So these are some of the topics that they cover in the diabetes prevention program: healthy eating, move those muscles, problem solving, how to manage stress. Because like I was telling you guys before, stress can elevate your blood sugar. How to, look, it addresses negative thoughts. I mean, these are things that we all battle with. I always tell patients, my holistic training really helps me to take care of patients with diabetes, because things like sleep even affect your blood sugar. And when I tell patients that, they can't believe that. Oh, yes, sleep actually can affect your hunger hormones, which will thereby impact how much and what you eat, which will thereby impact your blood sugar levels. So it's all connected. And you can't, run 5 miles a day and then eat whatever you want. It still doesn't work that way. We still want people who are doing the healthy activities and exercise still to eat healthy. I think I hope I prefaced it here. Why do we want people to eat a healthy regimen? I don't want to use diet again. I don't want to use diet. People with diabetes have a higher risk for heart disease, and they have a higher risk for stroke. So like I was saying before, we don't only talk about carbohydrates. Yes, carbohydrates will raise your blood sugar, definitely. But when I talk to patients, we also talk about, hey, what are fats? Like, what fats do you eat in your diet? A lot of people don't even know. If you're putting some salad dressing on your salad, there's your fat. So we have to have those conversations, because in the diabetes world, because of the increased risk for heart disease and stroke, we always talk about the ABCs of diabetes. And what does that mean? Knowing your A1C. What is it? Where do we want to go? Okay, if someone is diagnosed with diabetes, the goal is to get their A1C 7 or below. Okay, so I always think about that. Where are you? Where do you need to go? Right? The second, A is A1C, B is blood pressure, C is cholesterol. So you need that physician input. And that's why I was saying before, it's good to talk, it's good to learn, but you need to go to your doctor. You need to talk to that healthcare provider. Where is my blood pressure? How is it? Where is my cholesterol level? It's really important, because we don't want people to try to do some of these things on their own. You need to know where you are, and you need to understand what your risk is. And genes are strong. Genes are very strong. I have high blood pressure in my family. I have high cholesterol in my family. I eat very healthy, but I keep an eye on my cholesterol because I feel like the older we get, the harder it is to control. So I always say being informed is half the battle. It really is important to just be informed. Okay, so I know it's everyone's favorite topic. Try to save it a little bit to the end. When we talk about diet, or I should say healthy eating, right? Look at your drinks. Like I said to you guys before, drinks are a major source of sugar, and a lot of people don't know it. So do you drink juice? Do you drink any soda whatsoever? Iced tea, energy drinks, they all have sugar in them. So we have to be careful about that whole group of drinks. How much does a person eat out? So this gives me a little picture of, what my patients are eating. So I always like to talk about two things. If you are eating out, it's more probable that your portions are not always what they need to be. Eating out, usually the restaurants and takeout places will give you more than you need. Also, eating out will imply sometimes that you're getting a little extra fat in there without knowing it. And you're also getting a lot of salt and carbs. So overall, eating out, in my mind, is a habit that has changed severely during COVID. The COVID pandemic has really changed people's habits with eating, period. So I like to ask patients about that. And it's funny how some people truly believe that, oh, when I eat out, I eat healthy. And then when we drill down, it's not as healthy as you think it is. Some of the research shows that 90% of people underestimate how much salt is in their takeout food, 90%. So what we don't realize is that a lot of the restaurants, to make the food taste better, they just add more salt and more salt. So we have to be careful. I always ask patients, where do you struggle with the eating? Is it your portion? Is it the type of food? Are you a late night snacker? Do you like to eat out a lot? And then we talk about how possibly you can make a small change. So I don't think it's effective, and in my experience, to try to ask someone to make a whole entire life makeover. It's too much. It's overwhelming. We usually try to say, chip away at one thing at a time. So I would say to someone, do you think you can cut back the soda? Cut back the juice. Go out to eat twice a week instead of 5 times a week, because I do see pretty extreme variances in people's lifestyles. I had a woman once who said she had about 12 Snapples a day. I had one man, I still giggle about this, who I informed that milk is a carbohydrate, and he said that he drank a lot of milk, upwards of 5 gallons a day. So sometimes things that we take for granted, people think milk is healthy, milk has protein in it, but again, that was not a healthy portion of milk to be having, especially when this patient was having trouble with his blood sugar. He had no idea that milk could raise your blood sugar. So drilling down to these little lifestyle habits does help to make improvements. This is a biggie. Check your fruits and vegetables. So I love fruits and vegetables. Wonderful. Give us vitamins, fiber, so good for us. But we have to think about some of them have more carbohydrates in them than others. So the beloved banana has double the carbohydrates than most other fruits. And one of the foods I talk routinely to patients about is cereal. The cereal can potentially be very high in carbohydrates. Unfortunately, a lot of people love to put a banana on the cereal with the milk. And slowly your nice healthy breakfast is becoming way too high in carbohydrates. So again, we talk to patients about, can you have a piece of a fruit at a time? And more is not better in terms of fruit. So sometimes people are like, oh, I want to eat so healthy, and they have like a bag of green grapes. Well, a serving of grapes is like 5 or 6 grapes, not a whole sandwich baggie. So we have to be a little careful in your portion. All right. And late night snacking and eating sometimes holds people back. I just talked to a patient recently, and she said, I love to have my fruit late at night. And I said to her, unfortunately, I think that can impact your blood sugar for the whole next 24 hours. If you eat late at night, it can be tricky for your body. And I asked her, what time do you eat dinner? She said 6. I said, well, what time do you go to bed? And she was insinuating basically like 1 or 2. So this is again how we were talking about balance in your life. And that's how I talk to patients. We need some balance. So if someone eats at 6, you don't go to bed till 2 in the morning. That's a lot of hours you're up. And that's probably why she was getting hungry. So we talked about maybe her getting back into that walk a day, which hopefully would make her a little tired, help her sleep better, maybe fall asleep a little earlier, which would also impact her late night eating because she was staying up so late. That's why it was contributing to her hunger. So again, balance is important. Okay. And I think hopefully the good weather, the good weather makes a big difference with people getting outside. Gardening is considered exercise. Walking your dog is considered getting exercise. So exercise doesn't just encompass like going to the gym. It's literally just being active. All right. So here we are talking about activity. What everyone asked me, well, what are the requirements? What do they want us to do? The reason why activity makes such a big difference in the insulin or diabetes world is that it helps to make your insulin stronger. So unfortunately, when a person is going through type 2 diabetes, their insulin almost becomes so weak, it becomes ineffective. And when a person is able to exercise, what it does is it makes that insulin strong again, and then that insulin works better. So I always tell patients, this is someplace that we could all do better with, and it's free, and it will help your blood sugars. So, the goal is 150 minutes per week. So you could do every day, you could do every other day. And the goal also includes 2 days of muscle strengthening activity. So when I was talking to everyone before about the diabetes prevention program, this is one of the 2 goals, is to get your activity up to 150 minutes per week. I believe the other goal was a weight goal to lose between 5 and 10% of your overall body weight, which essentially, if a person is able to do that, they go from prediabetes out of prediabetes almost automatically. But why do we love exercise? A lot of people aren't aware of all the benefits of exercise. We think, hey, we'll lose weight. Well, it's more than that. If you're able to regularly exercise, it helps to lower your blood sugar. It helps to lower your blood pressure. It helps to lower your cholesterol levels. It also helps to lower your weight, and it also will reduce anxiety and depression. So a lot of the community isn't aware that diabetes and depression are very good friends. They go together hand in hand a lot. And when someone is depressed and they are not treated for it, they don't really feel like doing a heck of a lot. So the inactivity then, spirals. And when people are depressed, their eating is off. So it's like a vicious cycle. And we try to help people with getting back to healthy behaviors. And a lot of that sometimes is needing to take care of your mental health, right? We can't leave that out. That's a very important piece. Like I said, pandemic's been unbelievably stressful. So we have to take care of our mental health too. Okay, so this is some interesting things that I wanted you guys to know about why activity is so essential. Physical activity can reduce anxiety, blood pressure, improve the quality of your sleep and your insulin sensitivity. So that's what I was telling you before. It makes your insulin stronger. For adults, physical activity helps prevent 8 types of cancer. And you can see on this list, I highlighted type 2 diabetes. All right, it's essential. You can't really skip it. And for all groups, physical activity reduces the risk of excessive weight gain and helps people maintain a healthy weight. So if you're a human, I think everyone knows the older we get, it gets a little harder to maintain a healthy weight. And regular exercise or regular activity helps with that goal of maintaining a healthy weight. Okay, it's pretty pivotal. This goes over, again, how to clean up your diet. I like that phraseology because I think a lot of people do well with their diet, but then maybe, or their food, but then maybe when they're tired, they seek out carbs, probably for energy. And by modifying your lifestyle a little bit, sometimes that can get better. So, a lot of people don't think it's possible. It is possible. You can clean it up, and it's not as hard as people think. So what I talk to people about is which foods are the carbs. So we have the grain group, which is what most people know of, the pasta, the rice, the bread, the crackers, right? Anything that's flour in it, fruit, and milk. Those are the three broad categories. Once a person has a good understanding of which foods are the carbs, then we ask that you monitor the portion of the carbs that you eat. No, we don't like the dieting, the fad diets, because too often they go the opposite way. It's not healthy for a person to have no carbs or too low carb. What do we need carbs for? Energy, right? If you deprive your body of carbs, it's not healthy at all. All right. We have to have some carbs for energy. And then again, I always ask patients to do a little survey of their own, habitual foods. Like, what do you eat every day? They might not realize that bowl of cereal is 2 servings instead of 1. So we do talk a lot about that portion. Let's measure it backwards. Let's see how many portions of that Raisin Bran you're having. Hey, there's raisins in there. Raisins are full of sugar. What else can we try another cereal? Something lighter. Yogurt can also potentially be high in sugar. Oatmeal, if you're having too much oatmeal or your serving size isn't the prescribed. And the drinks. And then again, there is no healthy fast food. So I always say I could write a little book. I had a patient once tell me he only ate the healthy fast food. And I said, oh my gosh, what is that? And he said, Wendy's and Chinese food, which is almost, that's not true. So you do just have to be careful and take a hard look at how much takeout you're eating. And if you're eating fast food, the likelihood is it's not going to help you in your goal to avoid diabetes, right? And this is pretty telling how many teaspoons of sugar are in some of these drinks. So you see juice, soda, iced tea, or energy drink, plain old orange juice, which a lot of people think is great, not so great in the sugar amount, all right? Very interesting. It's helpful if you can change. And then again, how do we look at a nutrition label? What I tried to highlight for you guys here is there's 2 things I ask people to look at that will affect your blood sugar level specifically. I'm not looking at anything else here. What is the serving size for whatever you're eating? So for this item, it's a cup. And then how many carbohydrates are in that cup? It says 47 grams. So we use the general rule of about 60 grams per meal, about 60 grams of carbohydrates per meal, not per day, per meal. So here I tell this story where I had a patient who told me that he cooked 3 times a day. And I said, wow, you cook 3 times a day. That's amazing. And then when I asked him what he was cooking, he said he had 3 big bowls of Raisin Bran every day. So there was a little bit of a disconnect as far as I was concerned, like what's considered cooking, but he was proud of his 3 bowls of Raisin Bran. The problem is that Raisin Bran, I think this is the nutrition facts for Raisin Bran. So if this man had 2 cups instead of a cup, you'd already be up to 94 grams. And that's before the milk. So what happened with this patient, and I put it down here, he told me he ate his cereal out of a Tupperware bowl. So I had the idea that it's not a cup. It's going to be more than a cup. So we really have to be careful, again, with drilling down to what we're eating, looking at those labels, and looking at the labels helps you to make healthier choices. Okay. Bananas, grapes, yogurt, some things to take into consideration. How much are you eating? I love bananas, but I'll split a banana with my sons or my husband, split it. Still get the same nutrients, you won't get as much sugar. And prevention is key. Okay. The reason why we're dedicated to helping people prevent and avoid diabetes is because there are so many complications from the diabetes. I always tell people, I saw a show once about diabetes and how the physician who gave the talk likened the sugar going through your system to ground glass and how much it hurts the vessels and the arteries in your system. And that's essentially true. So the risk of heart disease, the risk of stroke, it can hurt our eyes, it can hurt our kidneys. I always tell patients, I want you to preserve your independence. So I always make sure they have their eyes checked and have their feet checked, right? Autonomy is very important to people. So if you can prevent diabetes or you catch yourself in pre-diabetes, that's wonderful if you can prevent it. And like I said, the A1C is really wonderful in helping a person to understand their own diabetes risk. Okay. Interestingly enough, I'm one of 4 girls. I'm the baby. I'm the only one that had gestational diabetes, not in my family at all. So the doctor said to me, he said, Elizabeth, you don't fit the profile. Why do you have it? I said, I don't know. We had a good laugh. But unfortunately, that puts me at a higher risk for type 2 later on in life. So I still get my A1C checked every time I have my blood drawn, and I look at it. And for whatever reason, I always think, Beth, it must have been somewhere in your genes, and not my sister's. But that's the way life is, and I'm more informed, and I watch out for it, and I make sure I eat healthy, and I get some exercise with my little boys, and I'm probably healthier for it. I got to be honest with you. I made a lot of good changes during that time in my life, and I love making the changes. So I think that is it. And we can take some questions. I would love that.
Great. Thank you so much, Elizabeth. That was so great.
Thanks.
Like she said, if anybody has any questions, please feel free to enter them in the Q&A spot. I actually have a couple of questions myself.
Okay, sure.
You talked so much about sugar in drinks.
Yes.
Can you talk a little bit about sugar alcohols and how those might differ?
So sugar alcohols, we still do have to be careful with, because sometimes the sugar alcohols in our system can be perceived as sugar. So we do still have to take them into account. You ask a good question, Emily, because a lot of the community loves to ask me about, the aspartame. Oh my gosh, it's such a hot topic, right? The aspartame and the sucralose. And my advice is it's okay in small doses, right? Because the literature says, I know with saccharin and some of the older ones, they were worried about like literally cancer risk. So unfortunately, our FDA has said it's safe. Oh, it's safe, it's safe. But I do have to tell you, overall, it does create problems in your body, in that sometimes your palate becomes so used to that ultra sweet taste that if I, have those aspartame drinks all day long, and then I go to have a strawberry or a pineapple, it's not going to taste as sweet to me now, because I'm so used to having those ultra sweet drinks all the time. The other issue is that your body has a really hard time breaking those fake sugars down. Your body doesn't understand what they are. It's confused. So in essence, when you are eating or drinking those sugar alcohols, your body can let the food wait in your belly. I don't know how else to explain it, because it's trying so hard to break down the fake sugars. And then you can get bloated and have just feel not well to say, because the bloating gets out of hand. But then again, I say to people, if you have diabetes and you drink like Coca-Cola, and I've had some patients that are literally like have an addiction to soda, then the diet is by far healthier. So it really, depends on the person. If a person can do small amounts of it, it is a help. We try very hard not to make people who are trying to, make their diets healthier feel deprived. So again, it's like a balancing act.
That's great. That's very helpful.
Yeah.
How much do statins increase blood sugar? Wondering about the risk versus benefit of taking statins to reduce LDL cholesterol in a pre-diabetic person.
Very, very good question. The literature that I've read shows that typically you don't run into problems with the statins unless you've been on it between like 5 and 10 years. So it does take time, and it is also one of those meds that's dose dependent. If you get your A1C checked, that really is your answer, because I always say the literature can say whatever it wants, but the literature doesn't know your genes or your other risk factors. I think that taking a statin is heavily important. I have high cholesterol in my family. There is no healthy amount of eating that I am going to do that's going to change my cholesterol levels that drastically like a statin would. Statins are the one class of drug that has drastically improved people's quality of life, length of life. So to me, the weight of the benefit far outweighs the risk of a little bit of an increase uptick in your blood sugars. I'm a firm believer in statins, and I know there are a lot of naysayers out there. But my dad had a stroke at 62, and if I can avoid that, I'm going to do it. And I'm going to take the statin if they think it's indicated. Because like I said, I'm all for making healthy changes, but genes are very strong. So we can only do what we can do. We're not superheroes and we can only change so much. We can't change everything. And I think that's really hard for some people to come to terms with. They always think I could do better. And I say, but the genes are there and you can't deny the genes. You can't skip over the genes. You can't, so there has to be a little bit of a talk about being, realistic and understanding, how much understanding do you have of your own genes? So that's important.
Right. Okay, great. We've definitely got a few questions here. I want to be cognizant of your time, so we'll get through what we can.
I'm sorry.
No, not at all.
I'm a talker.
Is there another cholesterol med besides statins that won't potentially raise sugar levels?
Yes, there are. I can't think of the names, but through my nursing experience, there are different classes of anti-cholesterol medications. So yes, the answer is definitely yes. If you are that worried about it, like I said, have a discussion with your physician. But there are certain ones that can work on like your GI tract. Some of the different classes work in different systems in your body. So not all of them are statins. I just find that the statins are probably the most potent and the strongest in that arena. But yes, there are other classes. You can definitely talk to your physician and explore that.
Okay, great. Are there better fruits and vegetables to prevent higher sugars and carbs?
Okay, good. Very good question. So it's funny on the carb side, potatoes are carbs, not vegetables, which makes me laugh. Of course they're vegetables, but they are carbs. So potatoes are considered carbs. Corn is a carb. Peas are a carb. So that includes the sweet potato, the white potato, peas, and corn. Those are all carbs. And then the few fruits that we do talk to patients about, just monitoring, be careful, is the banana, like I said before, grapes, and raisins. Raisins are very high. They're like sugar pellets. And dates, which a lot of people don't eat. Sometimes that's a cultural food. I've found that a lot of my Italian patients have told me that dates are very healing. And I say, they're not healing for the diabetes patients because they're so high in sugar. So you have to be a little careful.
So then I guess you could say, as far as healthier fruits and vegetables, you could say like dark berries are better to have.
Yeah, berries. I'm sorry if I missed that point. Berries are great. Strawberries, blueberries, apple, like a normal size apple, 15 grams. So most fruits, if you have like a regular serving or like a normal size pear, is usually between 15 to 20 grams of carbs. And that is the recommended amount for a snack. So it's perfect. Yeah, berries are wonderful. I think it's like a full cup of blueberries is 15 grams. A cup of strawberries is 15 grams. Sometimes I'm fascinated. Like I think in my head, pineapple sweeter. It's essentially not. So you can eat those. And if you guys want to look up, what I do on my phone is I'll put in like, you could do blueberry carb amount and it'll tell you the serving size and how many grams. Okay. So that's an easy way to cheat. I look it up all the time.
Yeah, that's very helpful.
Yeah.
Looks like we've got just a couple more here. My A1C is 5.7 and I take 850 mgs, I don't want to butcher that, of metformin every morning after breakfast. Is this okay?
That is wonderful. And I love metformin. Metformin is the oldest, cheapest, most effective drug in the fight against diabetes. It works in multiple pathways in your body. It helps to increase this insulin sensitivity. It's a wonderful drug. And you're taking it exactly the right way. So you have to take the metformin with food. And sometimes I ask patients, like, when do you take it? And they take it at the wrong time, but you get the best result from it if you take it with food. So that's great. A lot of patients, and I'm happy for them, will find themselves in prediabetes, take the metformin, will either stay in prediabetes or go lower. So that's wonderful. If you're 5'7" and the metformin is preventing you from going into diabetes, A+, that's wonderful. That's great.
And last one here, you mentioned that milk is high in carbs. Are the alternatives like oat milk, almond milk, and yogurts based on those better?
Good question. So if you have a cup of milk, that's 15 grams. Again, for my milk lovers, I don't want to say no milk. You can drink your milk, but then when you think about a meal and you're allotted 60 for a meal, if you have the cup of milk, then you get 45 grams on your plate. And I always say to my patients, most patients want to eat those 60 grams and not drink them. So yes, you can have the milk, you can have it, but then, if it's with a meal, then you'd have less carb amount on your plate. I have looked at, I think, almond milk, and it is a little bit lower in the carb. I was surprised. I thought they were all equal. They're not all equal. So I think the almond milk was actually less. Yeah, I think that. But then you have to be careful too. Like, I always look at the fat and look at all the things. You have to look at all the pros and cons.
All right, that's awesome. Thank you so much, Elizabeth, for taking the time to be with us today. Thank you, everybody, for joining. You'll be receiving a survey. If you could please complete that, just so we know what you'd better like to learn in the future. And everybody, please enjoy the rest of your afternoon. Thanks so much.
Thank you. Thank you guys so much.